Welcome to this episode of Evidence of Greatness, where we consider each time research and evidence that supports the solution-focused brief therapy approach. And for this month, what I want to do is address a question that we get asked quite a bit. And the question is, can I integrate solution-focused brief therapy with another modality? And there isn't any research available that shows, does that integration work? Does solution-focused integrated with something else, does that work well? And so one of the things that I'm going to do is just take that question to a bigger level, which is which is better, eclectic or integrative therapy or a single modality therapy? And so I just want to look at the broader question, not necessarily specific to solution focus, but in general, should we be integrating and using techniques from various approaches and integrating them together, or should we be using a single modality therapy? So one of the things that I think is really, really striking is that when I was doing a literature search, I was looking for research, especially around eclecticism. If I take and mismatch various techniques from various approaches, there is actually, I couldn't find, and maybe somebody else knows of something, and if you do know of something, please let me know and send it to me. But in all of the research that I was able to do, I couldn't find a single article that tested and evaluated the effectiveness of an eclectic approach. Typically, if you follow this series, you know that what I normally do is I pick an article and then I break down that article and make comparisons or draw implications for solution-focused brief therapy. But I can't do that this time because I couldn't find any articles that really addressed and evaluated an eclectic approach. So for that purpose, you're really just going to have to listen to me talk, and I'll try to make this as clear as possible. But this is the first time that the evidence of greatness isn't based on an article. And I think that's striking. I think that's important because that in and of itself shows using an eclectic approach may not be that effective, or at least we don't have research to support the effectiveness of an eclectic approach. Now, I need to be really clear here. We're using these words eclectic and integrative interchangeably, and in the next slide, I'll kind of pull that apart a bit. But for the time being, I'm simply talking about an eclectic approach, not an integrative approach, and I'll address an integrative approach in just a bit. But again, there's no article out there that shows the effectiveness of an eclectic approach, which means that if you want to use an evidence-based approach, if you want to use an empirically supported approach, perhaps eclecticism isn't the way to go. So that then gets to what is eclectic and what is integrative. Eclectic therapy is selecting and combining techniques from various therapeutic modalities. And typically the reason that people will do this is they'll say, my client has a specific need, or my client has a specific preference that I'm trying to meet. So there isn't really a combining of two therapeutic approaches, but instead it's kind of a grab bag where I take this therapeutic intervention and this therapeutic intervention, and I'm just applying them as needed by my client. That is then compared to or contrasted with an integrative approach, which seeks to integrate two theoretical orientations and brings those techniques associated with those orientations in their totality into a cohesive and coherent framework. And so really if we're going to do this integrative approach, this really requires that we understand the philosophical theory or the underpinnings, the philosophy of change, and we reconcile those various components within each of the individual theories to combine into another theory. Now, I mentioned before when we were talking about there was no article about eclectic therapy. One of the things that I'm going to say here is there are articles and even books written about integrative therapies, and sometimes, a lot of times, these integrations are called frameworks. What I would say, there is some research that evaluates these various integrative approaches and the various frameworks. But I chose not to consider those at this point, because what that in essence does is it takes two or more approaches, therapeutic approaches, combines them into a meaningful approach, which in essence then just creates a new singular approach. And therefore, it doesn't do me any good to evaluate those other therapeutic approaches in a platform where we're considering solution-focused brief therapy. So I am definitely not saying that other integrative approaches aren't working, aren't effective, but it's beyond the scope of this. But what I really want to think about and talk about is really when you bring those together into an integrative approach, you've done it really thoughtfully, you've done it really meaningfully, and in essence, you've just created a new combined approach. And therefore, it's no longer a mix of two things, but it's a standalone component. It's very much, if you think about it, cognitive therapy and behavioral therapy, they were two different separate things. And then people started combining them and mixing them and created cognitive behavioral therapy. And as you think about it, there are lots of evaluations of cognitive behavioral therapy, which is an integrative approach. But again, that's beyond the scope of this project. So for the bulk of this time, really what I'm going to talk about is eclecticism, and just mixing and matching, using one approach at a certain time and then using another approach at another time, without really giving consideration to the impact of that. Now, I do want to also say, I might use, let's say, a narrative approach at one moment, and I do some things with my client in that vein. And then in the next session or a few sessions later, I maybe I pick up a structural approach and I use that in a session. I would say this then also gets us close to eclecticism, where I'm taking one approach and applying it one after the other. Again, there isn't any consideration of the impact of that. There's no research study to say if you use various approaches at different times, is that effective? And so again, I'm gonna warn, perhaps if you're looking for an evidence-based or empirically supported treatment, mixing various approaches at different times may also not be an effective approach. So I hope that's clear. If you have questions about that, let me know. I'm happy to engage in a further conversation about it. So then we get to which is better, eclectic or single modality. And interestingly, there's no clear answer to whether eclectic therapy works better than single modality therapy or vice versa. And the reason for this is because there's no articles that study eclecticism. There's no research study that then looks at, if I take this eclectic approach and I compare it to a single modality approach, which one comes out better? So in addition to not having any research that just looks at eclectic therapy and the effectiveness of it, there is no therapy that also compares that to a single modality. And for that reason, then we can't definitively say one is better than the other. But again, there is lots of research out there that various single modalities are effective. So that I think is striking, that there is no research that's comparing single modality to eclecticism. One of the things that when you look at the literature about eclecticism, oftentimes they consider things like client's individual needs, therapist skills, and therapeutic alliance. And what you'll hear in those things is common factors. So sometimes people conflate eclecticism, meeting my client's needs, with common factors, the factors that contribute to effective therapy. Now, I think that there might be some overlap, that eclectic approaches may attend to various aspects of the common factors, but that in and of itself doesn't mean that eclecticism is effective. It just means that there's overlap. Without evidence to show that a particular approach is important or valuable, we can't say then that the common factors are influencing the effectiveness of that approach. So again, one of the things that I think is important is that even in single modality therapy, research that's available has mixed outcomes. That some single modalities are more effective than other single modalities. And so I think that is also sometimes an error that people make, is that any therapy is effective. And I think that we know that there's lots of studies out there that say some therapy is more effective than no therapy, but that doesn't then default to all therapies are equally effective. So I think those are two important factors when we're looking at this idea of, can I mix with something else? And the reality is, at this point, I mean, you could, but there's no way to measure, does it actually work? So I'll get into that in a little bit more. So here are some research differences, which I think are important. Eclectic therapy, again, most of the literature is a theoretical literature. So when they talk about like mixing things, there's no empirical literature. So again, you can try Googling it, even with Google Scholar. I looked at things like ResearchGate and those kinds of things to see if I could find some, and I couldn't. So if you happen to know of some that evaluates the effectiveness of eclectic therapy, please let me know. But oftentimes this literature is considered the common factors literature, which is what I just went over. Then this means that we know the components of effective therapy, but we don't know how they fit together. Again, I couldn't find a single article that showed that it was more effective than single modality. Integrative therapy, again, which I think is really, really interesting here, is that 85% of clinicians that are surveyed say they use an integrative or an eclectic approach, which again is somewhat alarming if they're using an eclectic approach, because we don't know if that's effective or not. Interestingly as well, when you ask those people who are using integrative or eclectic approaches, how many approaches are you combining? How many approaches are you integrating? The average number is 4. So they're taking 4 therapeutic approaches and they're combining them in various ways. Again, one of the reasons why integrative therapy is really, really hard to evaluate is that those 85% of clinicians, let's just say that there are 85 clinicians, because we take it out of a sample of 100. There's no research that shows, are those 85 clinicians combining these 4 approaches in the same way? Are they taking various techniques from the various approaches and mixing them in different combinations? Are they taking, typically I work from 3 approaches, but every once in a while I bring in a 4th, whereas somebody else might say, typically I work from 2 approaches, but when needed, I go to these other 2. But sometimes, again, we have to keep in mind that this is just an average. So some people who use an integrative approach might say, I only use 2 approaches, and somebody else might say, I use 6 approaches. So again, it's very hard to evaluate integrative therapies because we don't actually have a clear understanding of what they're integrating and how they're integrating and how often they're integrating. And again, a point that I made right at the beginning is that integrative approaches often turn into new theoretical frameworks. And again, if that's the case, now we just have one approach, and it's no longer an integration, but it's a meaningful framework that's been developed. And so in some sense, it turns into a singular therapeutic approach. So that's what's really, really difficult about evaluating, does integrative or eclectic therapy work? In research terms, we would often say there's too many mediating and moderating variables. There's too many confounding variables that make it difficult for us to say, is this effective? And if we can't individually say eclectic or integrative therapy is effective, then it's really hard to then compare it to a single modality and say, is it more effective than a single modality? So you can see here, it just gets really complicated really quickly. And so when people ask or people advocate, like, I just do what my client needs me to do, it begs the question, well, how do you make those decisions? And how do you know it's effective? So with model-specific therapy, there is a significant research body that evaluates and validates many models. It's really much easier to isolate these various therapies and research them because we can test what they often call fidelity. How closely is it being done to what the prescribers outline it should be done? So in essence, are the clinicians doing what the theory says they should be doing? And if so, how close are they doing it? If we can test fidelity, then we can also test effectiveness and get outcomes. So again, you can see here, it's much easier to evaluate a specific model than it is to evaluate an eclectic or an integrative approach. So here are some of the challenges that make it difficult. And now this is beyond just like research itself, but these are reasons why doing research might be difficult with an eclectic therapy. From an assessment level, think about how people oftentimes talk about this. They say, I listen to my client, I determine what that client needs based on the individual circumstances, and then I give an intervention that's specific to that need. Well, that requires assessment. We have to assess what the client needs, and we have to assess what their preferences are. If there's no research that says there's a specific approach, specific intervention that meets that specific need, because again, typically it's about the model as a whole, not necessarily the specific interventions, then I'm kind of grasping at, well, maybe I'm going to use a CBT approach and an intervention from CBT. But it isn't often that we have research that says a specific intervention works. And we also don't have research that says this intervention works in combination with something else. So again, it requires me to assess what do they need. It requires me to have an extensive knowledge of what research has been validated and to apply a specific approach to a specific problem. In addition to that, I have to do this in real time. So I don't have much of time because I have to carry on a conversation. So through my assessment, I have to gain enough information to access my knowledge while continuing the conversation. So again, this is a tall order to ask clinicians to be in charge of. In addition, if you go down to those next bullet points under the research, a study can only be conducted on specific approaches, meaning that the eclectic approach can't change. I can't, from one client to another client, change what it is that I'm doing, or it's no longer replicatable, it's no longer studyable. And so again, it takes out this individualization because now I have to mix a new combination of things with my next client, and therefore I can't compare the research or the approach that I did with the first client with the approach I did with the second client, because by nature, it would be different. So this lack of consistency, again, it leads us to how are we combining these things? Am I using 2 approaches? Am I using 4 approaches? Am I using just one intervention from an approach? Am I using predominantly one other approach and then just mixing in a sprinkle of something else? So again, the lack of consistency in how it's applied makes it very difficult to isolate the variables that are making a difference. In addition to that, there's some researcher bias where usually practitioners will use what they like. And so I would need to know what is it about this practitioner that's gravitating to certain things, and how do I control for that in research? So again, you can see here in all of these bullet points that it gets very, very difficult to evaluate, does mixing things work or not? But it gets really clear when we use one single modality. So the takeaway is there is no evidence out there that says eclectic therapy works. So therefore, if 85% of clinicians are saying I use an integrative or an eclectic approach, it is concerning that they probably can't back up, except for with anecdotal evidence, that what they're doing is effective. So if you couldn't tell, I err on the side of single modality therapy. And in my case, that's solution focused brief therapy. And the reason why, from a research standpoint, that I go to single modality therapy is that there's a lot of evidence that says that it works. And there is no evidence that says that I need to mix that or do something different. Now, a lot of times people will ask a follow-up question, which is, Does solution-focused brief therapy work with every presenting problem or every client that comes in? And the answer to that question is, well, we don't know. What we do know is that there's extensive literature out there that says that solution-focused works, and it works with a huge variety of presenting problems. But inevitably, there might be one client who comes in and who says, you know what, this doesn't work for me. Solution-focused brief therapy, or I think any other single modality therapy, doesn't claim that it's 100% effective or 100% applicable to every single person. But what it does say is that we know what this is, we can measure it, and we can test it. And we know that it works with a significant number of people. So if I had to, from a research perspective, err on the side of the single modality therapy or an eclectic approach, there is a huge amount of research that says that single modality works for a lot of people, maybe not everyone, but there is no research that shows that an eclectic approach works with anyone. So if, from a research perspective, if I had to make clinical decisions, if I had to make legal considerations, if I had to make ethical considerations, without any empirical evidence, I would have to side on the side of single modality therapy. So I hope that that is helpful to you. I know that that's probably somewhat controversial, especially since 85% of clinicians in a study say that they use something that I'm not recommending. But I think it's really, really important to have our clinical practices backed by evidence. So if you know of evidence that's available about eclectic therapy or integrative approaches, please let me know. I would be happy to consider that. Again, I think integrative approaches probably also have lots of research available on them, so I'm not putting them in the same category. But I think that people who are mixing and matching need to be very, very cautious about doing that based on the lack of research. So let me know what your thoughts are. I would love to hear what you have to say. And until next time, I'll see you later.